Hello guys. For those of you who are preparing for NEET PG, FMGE and INICET, these days multiple resources are available. Main videos, rapid revision videos, quick revision videos, BTR, DVT, online, offline, boot camp, residential classes, etc. Sometimes having too many choices itself creates a confusion. So what if I tell you there is a book which will help you to achieve your goal of quick revision and solve your problem to a great extent? My name is Dr. Ramgopal. I'm a full-time ophthalmologist and author of Sure Success Magic. In this short video, I'll be unboxing the new 15th edition of Sure Success Magic and showing the highlights of the book which will help you to crack your exams. This book has been the trusted all-in-one lifesaver book for hundreds and thousands of PG aspirants, and I hope it will help you to achieve your goals also. So this is the cover of Sure Success Magic 15th edition, which I have just taken out of its plastic cover. So let us open this and see inside. Coming to the table of contents, this is a book which contains all 19 subjects, and some subjects I have subdivided where the content is more. For example, if you see microbiology over here, microbiology, parasitology, immunology separate, so that covering them becomes easier and goes on and covers all 19 subjects. Now starting off with embryology, you have the basic necessary text over here. What you see in red over here throughout the book, these are the small mnemonics scattered throughout the book. You will find them. I'll show you in many more pages also. And I want to highlight what I call as clinical correlation. Since we are talking about spermatozoa, cartilaginous syndrome comes over here. Anatomy comes, I'm talking about hip joint, and you have Trendelenburg sign over here, which is the clinical correlation. Coming to physiology now, talking about hypoxia, different types of hypoxia. I want you to note the tables over here, and there's a lot of stuff in bold and italics throughout the book. So what this indicates that it has been asked as an MCQ earlier, or it is more likely to be asked. And again there, a clinical correlation box. So if you're not able to read, at least in the basic sciences, you need clinical correlation because all questions are clinical these days. At least the clinical correlation boxes, if you read, you will be covering a good portion of the likely questions. This is in biochemistry, glycogen storage diseases, again, a lot of mnemonics. And these are not very difficult mnemonics. These are simple, goes on and on throughout the book. And this is something in microbiology. You will find images, representative images everywhere. For example, this is in parasitology, the types of eggs which you will see, and these are likely to be asked or have been asked earlier. And again, I talked about mnemonics. This is in general pharmacology. You find whatever is in red over here makes the mnemonic, and so on. It goes on and on and on. This is somewhere in dermatology. And if I just leaf through the book, you will see a lot of images, a lot of boxes, and you will see that majority of the book is in white because this helps to annotate. If you want to add points, you can easily add points because the coloring is minimal and it is more of white. So add points with your blue or black dot pen or gel pen, that works. And highlighting also becomes easier in the book. And this is ophthalmology. You will find it's an image-based subject, so a lot of images in ophthal, and as you're seeing, so it goes on and on. And although the book runs into about 1,000 pages for 19 subjects, that is very less actually. It is very compact and concise. And one of the new highlights of the book this time is the scratch code which you see over here. Use the scratch code, then scan this QR code, register, and you will find access to some other things like the topic index of the book. Why have I given the topic index? Because some of you will be, obviously all of you will be using other resources. I will tell you how to use this book in a subsequent next video. So suppose you have studied about iron deficiency anemia in your main notes or rapid revision. So find the topic under hematology and read this. You will find that most of the stuff covered in your RRs or rapid revisions or similar, I would have already included in this, and sometimes you will find more points also. And the hits videos is something which I have started off. early days, but I started off with ophthalmology videos. These give you a instant topic summary. And PYQs, I have given this as an MCQ set. Right now, Ofthal has been uploaded to a few chapters, and it'll every 15 days there will be updates over here. So why are these MCQs important? This, whatever text you read, either in this book or in your notes. See, notes give you the knowledge, but how do you test your knowledge? How do you know you remember what is there in the notes? For that, you need the PYQs or the MCQs. So here, when I mean PYQs, I'm not talking about only PYQs, but MCQs also. Hope this short video has helped you guys to gain a short insight into what this book is all about. So there are numerous images. If you see, there are more than 1,130 images in this book, more than 500 mnemonics. If I pick up a random page, it is very likely that I'll find a mnemonic. For example, I'm looking at the developmental milestones over here. So I just go over here and say 4 years. At 4 years, you hop on one foot is at 4 years. So at 4, you hop off the floor. So that is a simple rhyme or mnemonic which you can remember. And if I'm talking about orthopedics, again, you're talking about, the famous Faber for anterior dislocation, Father for posterior dislocation, and coming to the JVP waves, again, you'll find that these ECG changes. So a lot of stuff. I could go on and on talking about this, but I'll probably stop it here, and hope this book helps hundreds and thousands of you to achieve your goal. All the best, guys. Study well.